name is Cliff Robinson. I'm a radiation oncologist at Washington University in St. Louis. One of the most common questions I get when someone comes into the clinic and wants to tell me about how the experience will go during the radiation treatment for their lung cancer is, how are you going to know it's working? What are you going to be checking to make sure that it's working? What are you going to do if it's not working? And the reality is that tumors take time to shrink and change and die. And that's true whether it's chemotherapy or radiation. So during the course of your radiation treatments, as you lay there during the treatment, nothing will be changing visibly, nothing that we can see and nothing that we can react to. As you go through each one of those treatments every day, you will get x-rays or you will get sometimes specialized forms of CT scans to make sure that you're in exactly the right position and the radiation is going on target in exactly the right place every day. Those images are not intended to tell us whether it's working. However, we can often see if there are changes during treatment. So if you're receiving a course of radiation that's perhaps 6 weeks long, it wouldn't be inconceivable that a few weeks into treatment, we may start to see the tumor shrink. Now, many of us enjoy seeing that, and it's a nice positive sign, and it's something that can be reinforcing that it's working. And so we'll sometimes show you those images. But the reality is that in most cases, whether or not we see the shrinkage at 1 week or 3 weeks or 6 weeks, or perhaps most of it occurs after the treatment's done, there's no clear reason to believe that that has any indication on how well it will work in the long term. An analogy I'll often use is thinking of the tumor as a weed. If you place some weed killer on that weed and you check it a few hours later, it doesn't look any different. But if you come back over a course of weeks or a month, it will slowly shrivel and die. And so these are the types of timescales we're thinking about with many tumors in terms of how quickly they shrink. The one exception to the rule of can you see whether it's changing and will you do something about it is that on rare occasion, if we see that the tumor has changed a lot, or if something's changed about your internal anatomy, say you've gotten some fluid on your lung or a pneumonia, or something else has happened which has caused this to shift into a position or got smaller or differently located than it was at the time of your initial CT scan when we planned it, we may choose to pause the treatment and replan the radiation. And that's called adaptive treatment or adaptive radiotherapy. And that's something that you and your doctor can discuss and whether it's appropriate for you.